My name's Martin Duerden. I'm a doctor from the UK. I've been a GP for many years. I'm also involved in teaching around therapeutics and prescribing, and I've had a long interest in how we can best use antibiotics. Visiting Thailand, the thing that really strikes me is it's very easy to simply go into a pharmacy and obtain antibiotics. You don't need a prescription, and the pharmacist is quite happy to provide them to you. That's quite different in the UK. The use of antibiotics is heavily regulated, and you really do need to have a GP's prescription. Despite that, even in the UK, we consider that we overuse antibiotics. Coughs, colds, sore throats, respiratory tract infections, as we call them, are generally infections that just get better without using antibiotics. There's a lot of research evidence that shows, even though some of them might be caused by bacteria, though the majority are caused by viruses, most of them will get better within a week or so without the need to use antibiotics, and the evidence shows that antibiotics have very little effects. What they can do, though, is cause really quite severe adverse effects, such as things like allergy, such as causing rashes, such as causing diarrhea, and sometimes causing nausea and vomiting. There are a wide variety of effective treatments for respiratory tract infections. The main thing to do is to treat the symptoms, because, as we know, most of these infections will simply get better without the need to use things like antibiotics. So within a week or so, people will feel much better, and we need to use symptomatic treatments to tide them over while their immune system gets to work. So simple things like throat lozenges, using things to soothe the throat, maybe things like old-fashioned remedies such as honey and lemon and warm drinks will help. Things like paracetamol and ibuprofen will also relieve the discomfort that's caused by these infections and help to relieve any fever associated with them. Many people these days seek advice and information over the internet and from things like social media. There can be a lot of misinformation or poor information, so it's important, if people do that they go to a credible source. In the UK, we have a very good resource for patients, which is called NHS Choices, and that provides very useful information and will suit many people. I think if people are worried about their symptoms, they should see the pharmacist as the first point of call. Going to the GP is just not necessary in most of these instances, although many patients do go unnecessarily, and I think GPs feel somewhat under pressure and often prescribe antibiotics when that's unnecessary. So see the pharmacist as somebody that they can go to give them advice and to direct them and help them select the most appropriate symptomatic treatment.